Mr. Smith came in through the ER with severe abdominal pain, and he was admitted into my unit in 2 North.
And they did a CT scan, told him that he had a bowel obstruction.
She was very upset and anxious to get in touch with the doctor. She was very concerned about her husband and the abdominal pain he was having, being concerned that, he had a previous history of cancer.
When we met Jennifer, who was the charge nurse, she was just wonderful. She asked us all kinds of questions about not just our medical condition, but the comfort, and wanted to know what it was we needed. What could she do to make it easier for us?
I was listening to her story, and I placed my hands on top of hers, and I told her, let me see what I can do. Let me see what I can do to help you.
And Jennifer said, I am doing everything to help you.
And thoughts raced through my mind, oh God, please help me. What am I gonna do?
As we were talking, she was saying to me, I've prayed about this. And I said, Jennifer, I have too. And all of a sudden a hand went around my shoulders, and here it was the doctor. And he said to me, I understand that you're a little anxious to have this surgery done. And I said, more than a little anxious. He said, when would you like to do it? I said, right now. He said, now doesn't quite work. How about this afternoon? I'm canceling all my appointments. We'll do it this afternoon. I said, that's wonderful. That's better than I expected. And he turned around and walked away, and Jennifer said, is that a God thing or what? And I said, oh yes, I could do a happy dance with you. It's so wonderful. In the last 10 years, we've been in 4 different hospitals with Joe. This is the first time that we have encountered nurses, CNAs, even housekeeping staff that has been so conscious of the entire patient care.
Sometimes God puts you where you need to be, even though you don't understand why you're there. And I shared with them how I was a young mother and I had lost my husband to cancer. So I always feel a little more close to patients when they are diagnosed with cancer. And so I grew very fond of Mr. and Miss Smith throughout their stay.
She prayed with us, and I was so very impressed. But it was just so helpful and refreshing and compassionate that you have to recover in all those ways, not just with whatever medicines they give you. So we were very happy with that.
After he had the biopsy, he was discharged. And 4 or 5 days later, he came back, readmitted with a pain in his arm. But luckily, God brought him back again for the second time, because at that time is when he ran into Dr. Riaz, which was able to get him connected to the surgeon.
Mark, and I don't know his oversight position, but it is one here at Florida Hospital, was so welcome. Every day he probably stopped in our room twice, sat down, took his time, wanted to know how everyone was performing, asked if they'd been doing their jobs the way they should do it, mentioned specifics, and we had to say to him, no, Mark, they're not doing it the way you think they are. They're going way overboard what you expect of them.
Well, here at Florida Hospital, we are encouraged to treat everyone in that bed as if we would the one we love the most. And if that was my husband in the bed, I would want someone to be there for me and help me through it, because I don't know how I would handle it.
This visit, because of that attitude, made our whole hospital visit so much more stress-free than it would have been otherwise.
Many years ago, I would have never thought that I could be this okay with the fact that more than likely I'm not going to be around a whole lot longer, but I intend to enjoy every minute of it. And for the staff, all the nurses and the staff, I thank you, because you were so kind and so helpful, and I really appreciate it. Thank you.